29th of May, an ambulance was called at 9:30 a.m. At 9:45 a.m., the patient was brought to BSMP. 10 a.m. registration. 10:15 MXpert surgeon. 10:45 finished DS. At 11 a.m., transferred to surgical department and start of medical treatment at 11:20 a.m. The surgery starts at 12 p.m.
Good morning, sir. Can I know what's your name and your age?
I'm Mark Sloan, I'm 30 years old.
Where do you live at and what do you work as?
I live at Lelina Street and I'm a carpenter.
Okay, what are your complaints today? How are you feeling?
I feel pain in the abdomen, at the right top of my abdomen.
Do you have anything else to add? Like, do you have vomiting or weakness?
No, but the intensity of the pain is low and it is reduced when I bend forward. I often feel weakness and fatigue when I stand up, and I always feel thirsty but I have no appetite.
Okay. Can you tell me what the color of your stool is?
My stool is in dark color and was repeated in watery form.
How long have you been feeling like this?
It lasted for many weeks.
Did you take any medication when you were feeling that way?
I took anti-inflammatory whenever I feel dizzy or weak.
Okay.
The patient complained of pain at his stomach area, but he has no other symptoms to determine the exact disease yet. Based on the data that we have collected, we could predict that it is due to dehydration, probably because of hemorrhage in the gastrointestinal tract.
Do you take alcohol often?
Yes, but I drink 1 bottle in a week.
Okay. Are you married?
No.
Okay. Do you have history of diabetes mellitus, TB, stroke, myocardial infarction?
No.
Okay. And also, have you been involved in any operations before this?
No.
Did you have any history of duodenal ulcer previously?
Yes, for the past 5 years.
Okay. And what medication did you take for it? Did you take any?
I took ibuprofen for 2 days.
Okay.
Upon general inspection, we could see that the patient scores 15 on the Glasgow Coma scale, meaning the patient could spontaneously open and close his eyes. Verbal response are oriented to time, person and place, and also motor response could obey to command. The skin looks pale and clammy, while the mucous membrane looks dry. Both of these are indicators of dehydration.
Now I'm gonna check for your vital signs and let me examine you. Okay. So let me check your blood pressure and your pulse and your respiration rate. So let me go with the blood pressure. Keep your hands straight. Okay.
How is it?
Blood pressure is 100 over 60.
Is it normal, right?
No, it's not normal. You have hypotension, so I can just conclude that for now. Okay. Your respiration rate looks abnormal. You have tachypnea and tachycardia.
Upon inspection of the respiratory system, we could say that the patient is in pain and he's having tachypnea. Tachypnea is an indicator of fluid deficiency, which could be caused by hemorrhage.
During cardiovascular system inspection, we found out that the patient's pulse rate is 120, meaning he has tachycardia, and blood pressure of 100 over 60, showing that he has hypotension. Both of these are indicators of fluid deficiency.
Okay, so we need to do furthermore diagnosis tests to conclude what problem is in you. So can you go and wait at the room over there. Do you feel pain over here?
Yeah, slight.
Okay. Here?
No, yeah, slightly. Okay.
Here also?
Yes, yes.
Okay. Do you feel pain over here?
No,
No.
no,
Here no. Here?
no,
Here also no.
no.
Okay. So your pain is over here.
Yes, yes.
And here also.
Here, yes.
Where is the pain very intense?
Bit
Here or
lower,
here?
Yeah, in the center, bit
Here?
lower, yes.
The pain is intense over
Yes,
here.
yes.
Alright. Okay. Here, right?
Yeah, correct.
Alright. Okay. Okay. After the inspection, we can see that you have dehydration, and we suspect you have internal bleeding. So that causes the pain in your stomach region. So we need to do one more test. We need to examine your stool. So can you give us a sample of your stool in this bottle?
Yeah, sure.
Okay, thank you. Okay, now we have the stool sample of Mr. Mark, and now we are going to examine the stool. Now we can observe that the stool is very dark and it has blood in it. This may be due to the internal bleeding of the GIT. To be suspected, the bleeding in the duodenum. Good evening, are you the relative of Mr. Mark?
Yes.
Okay, our patient Mr. Mark has upper internal bleeding in the GIT suspected at the duodenum part. Our patient has been observed that he is dehydrated and his vital signs are changed. He has tachypnea, tachycardia and hypertension. And mechanism of fluid loss is on intravascular fluid compartment due to blood loss. And he has deficit of the circulating volume. He has minimum of 1.5 liter of blood loss, which is a class 2 bleeding. And our patient has also consumed ibuprofen, which made the irritation on the GIT, which increased the chances of bleeding. After the inspection and examination of the report, this is the finding of Mr. Mark. Do you have any questions?
Intense.
Alright, thank you.